Don't run away from finding out. No one's going to take your child away from you. I'm Dr. Rania Ayat Hawayek. I'm a medical director and specialist pediatrician at Circle Care Clinic. Measles, we all know that last year there was a worldwide measles outbreak. So don't delay your child's MMR thinking that just because you're at home, you're safe. You know, just like COVID has slipped into households, measles is another virus that could easily come in because everyone around that child is immune, could carry it on their clothes, for instance. It's easy to catch. So measles would be one. The infant vaccines, the ones done at 2, 4, and 6 months, you leave an infant completely naked, their immune system completely vulnerable if you don't boost it with those extremely important illnesses that are life-threatening, if not vaccinated against. And the other one I would say actually would be meningitis, because yes, it's a rare illness, but it's so detrimental and the vaccine is extremely protective. So those would be the three. Same principles, they don't change. If a child has a fever that's difficult to control, that runs more than a day or so, depends on the age. If an infant less than 3 months had a fever, with no other obvious reason, like no runny nose or no one around that was sick, you would want that child to be seen, because an infant with a fever, if it was bacterial, is very dangerous, especially an infant in the first 3 to 6 months. If a child, so a toddler, had a fever but had associated runny nose, some loose stools, and still had their energy, still had their appetite, you're okay to sit on. But a relentless, uncontrolled fever, breathlessness, breathing difficulty to the point where an infant could not feed well, or an older child was breathless on minimal activity. And of course, the obvious things like seizures or like an accident with bleeding that you couldn't stem, a potential broken leg. The message here is COVID or no COVID. If your child has a medical symptom that doesn't seem to be getting better with what you're doing at home, or is affecting their ability to eat, to breathe, to move, or is like a bleeding issue, like a hemorrhage issue, you need to go to a hospital. And yes, we're all worried about exposure if you go to a hospital, but hospitals have very good systems in place. They have divided their emergency rooms into potential COVID and non-COVID, so for the bumps and lumps and things that are obviously not infectious related. But let's bring COVID back into the question. So for now, all our children are at home, and if we're all social distancing properly, they're not exposed to each other, which means that the likelihood of a runny nose or a cough or all these things that happen now is very low. And if they do happen, we immediately assume it could be COVID. It's correct to think that way. It doesn't mean it is COVID, but when you think it could be, you behave in a more safe way. You have a more safe approach. So let's assume your child does get exposed to COVID and has a mild fever. If your child does not have breathing difficulty and is still doing what they're meant to be doing, like their energy levels are okay, they're still a bit stable, they're eating okay, they're not breathless, you are okay to continue to observe this child at home. But if your child had contact with a known case or a case that you consider risky, it is, even though your child is well, it is important to find out whether it's COVID or not, because it has an impact on you. And there are so many, at-home services. I got this ad just this morning, that you can even call and get a checkup, get the test done at home. So don't run away from finding out. No one's going to take your child away from you. The message, what they're doing now is very sound. If someone is asymptomatic child or adult, they stay at home. But it's important to know for the contact tracing. So don't behave differently because of COVID, keep it in mind, but don't neglect something that could become life-threatening, like a bacterial infection that you think, oh, the fever is because of just a virus. It could be, a strep throat that can become a scarlet fever. It could be a pneumonia that has nothing to do with COVID. So seek the help, don't run away from it. We're keeping you safe, we're keeping ourselves safe. Vitamin D needs to be supplemented during this time, okay? Because it has been linked, low levels of vitamin D have been linked to low immunity. So it needs to be supplemented in this time because we all see less sun, whether we live in a villa or an apartment. When it comes to physical activity, look, I think similarly for those days, I think parents need to try and find ways of being creative. Especially for those people who live in apartments, you need to make the time to take your children out. Yes, I know they may need to wear masks, but if you are in an outdoor place very far away from others, you don't necessarily need to have, be reasonable. You don't need to have your mask on, even if you're told off. If you're nowhere near anyone else, no one else is in sight. you're okay. They need to run around. They need to, go out and run around in the park, and we can do that now. So don't keep yourself. I know the easy constitution has been worrying for so many people, but do use them to your advantage, because most people outdoors now are being safe. Most people are following the rules. Some of them because they don't want to pay the fine, but others because they understand they need to have the mask on. As long as you're doing the same, you'll keep them safe. So try and, I don't know, buy a trampoline, try and create obstacle courses at home, try and be creative and playful as much as possible, but also don't get anxious. Do accept the fact that they will have more in the way of screen time nowadays. They will be less active. Try and keep their diet healthy to balance that. They will sort of need less calories if they're not expending as many. I'm not saying make them go hungry, but keep in mind, their intake. And just use the outdoors when you can safely. So especially the younger ones, where those are informed, very important months in their life, they haven't built the social skills. They might be very scared, they might be very nervous. They understand that they haven't been going out because of a bad virus. So they might assume that anyone not in their household or their circle can have the virus. So they might even be additionally scared and averse to meeting other people. So what we can do as parents, as people who own schools, as older people around them, is in the run-up to that, climatize our children to the fact that when we go out, we need to do the distancing. When we go out, we need to wear the masks, especially if you live in a place where wearing a mask is mandatory. Take them out for a walk, take them out for the occasional trip to the places you're allowed to go to, like outdoor places. Children from 3 and 12, have them wear the mask, have them realize, just like us, I was very nervous the first time I went into a supermarket during this time. I feel safe at my clinic, I feel safe at home, but you know how we feel. My husband told me that he was a bit nervous the first time he took the car out after lockdown, because you feel, children are the same. You do it once or twice and you realize, actually, no, I can go out with a mask. Everyone else has one, I feel safe. And if they've done it 1, 2, 3 times and they don't get sick, in their perception, it feels better. Over the summer, I think schools need to work a bit and not leave students into taking pictures of what they're doing at school, getting students to virtually go through the school with the new changes on board, especially if they have colored, segregated areas where people need to stand, or new wash basins, or, what the security guard will look like. It's important for children to feel familiar with what they're going to see, because I feel that takes away a lot of the anxiety, especially when what they're going to see is different to what they remember. And I think that it would be a big sort of mistake if we leave them for the 2 months of summer without any communication and without any preparation. So that would be my request for school owners, actually, to do something.